Every day, thousands of seniors are quietly destroying their kidneys without knowing it. But here's the crazy part. The one habit that could save them costs less than $1 a day. Doctors aren't telling you this because they assume you already know, but you don't. What if I told you that 90% of seniors with kidney disease have no idea they have it? Your kidneys are working overtime right now, filtering your blood every single minute. When they start failing, you won't feel it happening. No pain, no obvious warning signs. Just silent damage building up day after day. Here's what's really happening in your body. Your kidneys are like tiny cleanup crews working 24/7. They remove waste from everything you eat and drink. But as you get older, these cleanup crews get tired. They need your help to keep working properly. The scary truth? Most people over 60 are making simple mistakes that speed up kidney damage. You might be doing 3 or 4 of these things right now without realizing it. The good news is these mistakes are easy to fix once you know what they are. Today I'm sharing 10 daily habits that prevent kidney failure in seniors over 60 that you need to know about. The first one will shock you because it's the opposite of what most people think. You're going to learn exactly what to do, when to do it, and why it works. How many of you have been told to drink more water but never learned the right way to do it? Drop a comment and let me know. Let's start with the biggest water mistake that's probably happening in your kitchen right now. Habit number 1, proper hydration. Problem: you're drinking water wrong for your kidneys. Here's the thing about proper hydration that most people get completely backwards. You've been told to drink 8 glasses of water every day, right? But nobody ever taught you when to drink it. That timing makes all the difference for your kidneys. The real problem is this. Most seniors gulp down water whenever they remember. Maybe 3 glasses with lunch, then nothing for hours. Your kidneys hate this. They work best when water comes in steady, smaller amounts throughout the day. Now listen to this. Your kidneys are busiest in the morning. They've been working all night cleaning your blood while you sleep. When you wake up, they're like a tired cleaning crew that needs fresh supplies to keep going. But most people grab coffee first, not water. Here's what you need to know about how to keep your kidneys healthy as you age. Start with 2 glasses of room temperature water as soon as you get up. Not ice cold, that shocks your system. Room temperature water gets absorbed faster and helps your kidneys flush out the waste they've been collecting all night. Then here's the smart part. Set a timer for every 2 hours. Drink 1 glass each time it goes off. No more, no less. This gives your kidneys a steady supply of water to work with, instead of flooding them all at once. The evening part is just as important. Stop drinking large amounts 2 hours before bed. Your kidneys slow down at night, and too much water late means you'll be up every hour. Instead, have small sips if you're thirsty. This simple timing trick helps your kidneys filter waste 40% better than random drinking. Your body stays properly cleaned out, and you'll sleep better too. How many of you have been drinking water at the wrong times? Let me know what time you usually drink the most water. Habit number 2, healthy diet. Problem: processed foods slowly poison your kidneys. Let me tell you about healthy diet choices that can save your kidneys from years of damage. Most people think they're eating fine, but they're actually feeding their kidneys poison every single day. Those convenient boxed meals, canned soups and frozen dinners are loaded with chemicals your kidneys have to work overtime to remove. You want to know something? Your kidneys process everything that goes into your mouth. When you eat processed food, it's like asking a janitor to clean up after a paint factory explosion. The mess is so bad they can't keep up. But here's the crazy part. Fresh whole foods do the opposite. They actually make your kidneys' job easier. Fruits, vegetables and lean meats come with natural helpers that support kidney function instead of fighting against it. This is important because senior kidney disease prevention tips at home start with what's on your plate. Your grocery shopping list needs a complete makeover. Stop walking down the middle aisles where all the boxes and cans live. Shop around the edges of the store instead. Here's your new shopping strategy. Fill half your cart with fresh vegetables. Any color works. Green broccoli, orange carrots, red peppers. The more colors, the better. Add fresh fruits that you actually enjoy eating. Don't buy what you think you should eat. For protein, choose fresh chicken, fish, or lean beef. Skip anything that's been pre-seasoned or marinated. Those seasonings are usually packed with sodium and preservatives that stress your kidneys. The real magic happens when you cook at home. You control exactly what goes into your food. Use herbs and spices instead of salt packets. Your kidneys will thank you by working better and lasting longer. Habit number 3, sodium control. Problem: hidden sodium is destroying your kidneys. What you need to know about sodium control is that it's hiding everywhere in your food, and your kidneys are paying the price. Most seniors have no idea they're eating 3 times more salt than their kidneys can safely handle. The scary part isn't the salt shaker on your table. That's only 10% of your daily sodium. The real danger is lurking in places you'd never suspect. Here's what's really happening when you eat too much sodium. Your kidneys have to work like crazy to filter all that extra salt out of your blood. Over time, this constant overtime work wears them down. The connection between kidney health for seniors and sodium intake is stronger than most people realize. Now listen to this. Bread has more sodium than potato chips in many cases. A single slice of regular bread can have 200 milligrams of sodium. Eat a sandwich and you're already at 400 milligrams before you add any filling. Your daily limit should be around 2,300 milligrams total. The real problem is that food companies don't make it easy to spot sodium. They use different names to hide it. Sodium chloride, monosodium glutamate, sodium bicarbonate. These are all just fancy ways of saying salt. Here's your simple label reading system that actually works. Turn every package around and look at the nutrition facts. Find the sodium number and do this quick math. If it's over 300 milligrams per serving, put it back. If it's under 100 milligrams, you're safe. Between 100 and 300 means use it sparingly. The best trick is to check serving sizes carefully. That innocent-looking can of soup might say 600 milligrams of sodium per serving, but the whole can has 2.5 servings. Eat the whole thing and you've just consumed 1,500 milligrams. More than half your daily limit in one meal. This simple system takes the guesswork out of protecting your kidneys from sodium overload. Habit number 4. Blood pressure monitoring. Problem: silent high BP kills kidneys slowly. Here's why this matters about blood pressure monitoring. Your kidneys are getting damaged right now if your blood pressure is too high, and you probably don't even know it's happening. High blood pressure is called the silent killer for a good reason. It doesn't hurt. You don't feel dizzy. You feel completely normal while it's slowly destroying the tiny blood vessels inside your kidneys. This is important because learning how to prevent kidney disease starts with understanding what high blood pressure actually does to your body. Think of your kidneys as having thousands of tiny garden hoses running through them. When your blood pressure goes up, it's like turning up the water pressure in those hoses. Over time, the constant high pressure makes those tiny hoses crack and leak. But here's the crazy part. Most seniors only check their blood pressure at the doctor's office. That's like checking your car's gas gauge only when you go to the mechanic. By then you might already be running on empty. The real problem is that blood pressure changes throughout the day. It can be perfect at 10 a.m. and dangerous at 3 p.m. Stress, food, even the weather can push it up without warning. Your simple tracking method starts with buying a basic blood pressure monitor from any pharmacy. Get one with a cuff that fits around your upper arm, not your wrist. Wrist monitors aren't accurate for most people. Here's your daily routine that actually works. Check your blood pressure at the same time every morning before you eat or drink anything. Sit quietly for 5 minutes first. Write down both numbers, the top and bottom. Do this for a week and you'll see patterns your doctor never catches during those quick office visits. The magic number to remember is 130/80. Anything higher means your kidney blood vessels are under attack and need protection. Habit number 5. Regular exercise. Problem: sitting too much starves your kidneys. You want to know something about regular exercise that doctors don't explain clearly enough? Your kidneys need blood flow to survive, and sitting all day cuts off that life-giving circulation. Most seniors spend 8 to 12 hours sitting every single day. Your kidneys are literally starving for fresh blood during all those hours. Here's what's really happening inside your body when elderly people develop chronic kidney disease. They develop from a lack of movement. When you sit for hours, your heart doesn't have to pump very hard. That sounds relaxing, but it's actually terrible for your kidneys. They depend on strong blood flow to wash away waste and bring in fresh oxygen. Weak circulation means waste builds up, and your kidney cells start dying. Now listen to this. You don't need to run marathons or join a gym to fix this problem. Your kidneys respond amazingly well to gentle, consistent movement that you can do right from your chair. The real problem is that most exercise advice for seniors is either too complicated or too scary. People think they need special equipment or have to get sweaty to make a difference. That's completely wrong. Your senior-safe movement routine starts with chair-based exercises that take just 10 minutes. Sit up straight and lift your knees one at a time, like you're marching in place. Do this for 30 seconds. Then extend one leg out straight, hold for 5 seconds and switch legs. Repeat 10 times. Next, roll your shoulders backwards 10 times, then forwards 10 times. Twist your upper body gently left and right 10 times each direction. These simple movements get your blood pumping without putting stress on your joints. The magic happens when you do this every 2 hours during your waking day. Set a timer and move for just 2 minutes every hour. Your kidneys will get the circulation boost they desperately need, and you'll feel more energetic too. Habit number 6, blood sugar control. Problem: diabetes silently attacks the kidneys first. Here's why this matters about blood sugar control. Your kidneys are the first organs that diabetes damages, often years before you notice any other problems. High blood sugar acts like liquid sandpaper flowing through the tiny filters in your kidneys. Every time your blood sugar spikes above normal levels, it scrapes away a little more of your kidney function. The real problem is that effective kidney failure prevention requires understanding how blood sugar timing affects your kidneys differently throughout the day. Most diabetics focus only on their daily average blood sugar, but your kidneys care more about the roller coaster rides, those sudden jumps from low to high and back again. But here's the crazy part. You can eat the exact same foods and get completely different blood sugar results just by changing when you eat them. Your body processes sugar differently at breakfast versus dinner, and most people have no idea about this timing advantage. Here's what's really happening when you eat at the wrong times. Your body's insulin works best in the morning and gets weaker as the day goes on. Eat a piece of toast at 7 a.m. and your blood sugar might rise gently. Eat that same toast at 8 p.m. and it could spike dangerously high, forcing your kidneys to work overtime filtering out the excess sugar. Your meal timing strategy starts with this simple rule. Eat your largest meal before 2 p.m. when your insulin is strongest. Make breakfast and lunch your main meals, then have a lighter dinner. This matches your body's natural rhythm instead of fighting against it. Space your meals exactly 4 hours apart. If you eat breakfast at 7 a.m., have lunch at 11 a.m. and dinner at 3 p.m. This prevents blood sugar from building up between meals and gives your kidneys steady, manageable levels to filter. The magic happens when you stick to this schedule for just 2 weeks. Your blood sugar will stabilize, and your kidneys get the break they need to start healing from years of sugar damage. Habit number 7. Avoid NSAIDs. Problem: common painkillers are kidney killers. This is important because learning to avoid NSAIDs might be the most crucial kidney protection step you take this year. NSAIDs stands for non-steroidal anti-inflammatory drugs. That's just a fancy name for common painkillers like ibuprofen, naproxen, and aspirin. These pills sit in medicine cabinets across America, and millions of seniors pop them daily without realizing they're slowly poisoning their kidneys. Let me tell you what happens inside your body when you take these medications regularly. NSAIDs block certain chemicals that cause pain, but they also block chemicals your kidneys need to function properly. Your kidneys depend on good blood flow to filter waste, and NSAIDs reduce that blood flow by up to 20% every time you take them. You want to know something scary? Taking just 2 ibuprofen tablets daily for a month can cause permanent kidney damage in some people. The damage builds up silently because these medications don't hurt when they're destroying your kidney tissue. You feel better because your pain is gone, but your kidneys are getting worse. Now listen to this. Most seniors take NSAIDs for arthritis, headaches, or general aches and pains. The good news is that natural relief methods often work just as well without harming your kidneys. Your safe pain management alternatives start with heat and cold therapy. For joint pain, try a warm compress for 15 minutes, then switch to a cold pack for 10 minutes. This combination reduces inflammation naturally without chemicals. Gentle stretching works better than pills for many types of pain. Simple neck rolls for headaches, ankle circles for leg pain, or shoulder shrugs for upper body tension can provide relief within minutes. Turmeric and ginger are natural anti-inflammatories that you can add to your food or take as supplements. They reduce pain and inflammation while actually supporting kidney health instead of damaging it. The key is consistency with these natural methods, rather than reaching for the pill bottle every time discomfort strikes. Habit number 8. Quality sleep. Problem: poor sleep disrupts kidney repair. Here's the thing about quality sleep that most people never learn. Your kidneys do their most important repair work while you're sleeping. During deep sleep phases, your kidneys essentially go into maintenance mode, cleaning out toxins that built up during the day and fixing damaged cells. When you don't get good sleep, you're robbing your kidneys of their only chance to heal themselves. What you need to know is that kidney function follows a 24-hour cycle called your circadian rhythm. This internal clock tells your kidneys when to work hard and when to rest. Poor sleep throws this rhythm completely out of balance, forcing your kidneys to work overtime when they should be recovering. Let me tell you, most sleep problems that hurt your kidneys can be fixed with simple evening routine changes that cost nothing. You don't need expensive mattresses or sleeping pills that might actually harm your kidneys further. Here's what's really happening when you sleep poorly. Your stress hormones stay elevated all night, keeping your blood pressure high and forcing your kidneys to filter blood under pressure. It's exhausting for these vital organs that desperately need those quiet nighttime hours to regenerate. Your sleep optimization protocol starts 3 hours before bedtime. Stop eating heavy meals and limit fluids to small sips only. Your kidneys slow down at night, and too much food or water keeps them working when they should be resting. 1 hour before bed, dim all the lights in your house and put away phones or tablets. The blue light from screens tricks your brain into thinking it's daytime, disrupting the hormone signals your kidneys need for proper nighttime function. Your evening routine checklist includes keeping your bedroom cool, around 65 degrees, which helps your body temperature drop naturally and signals your kidneys to enter repair mode. This simple temperature control activates kidney regeneration processes that only happen during quality sleep. Consistent sleep timing matters more than sleep duration. Go to bed and wake up at exactly the same time every day. Habit number 9. Don't smoke. Problem: smoking slowly suffocates your kidneys. Now listen to this about why you need to don't smoke if you want to keep your kidneys healthy. Every cigarette you light up is literally choking the life out of your kidneys. Smoking doesn't just hurt your lungs, it cuts off the oxygen supply your kidneys desperately need to function. Your kidneys are like busy factories that need constant fresh air to operate, and smoking fills that air with poison. Here's what's really happening inside your body when you smoke. The chemicals in cigarettes make your blood vessels squeeze tight, reducing blood flow to your kidneys by up to 30%. Less blood flow means less oxygen reaching your kidney cells. Without enough oxygen, these cells start dying off one by one, and once they're gone, they never grow back. The real problem is that kidney damage from smoking happens so slowly that most people don't connect the dots. You might smoke for 20 years before your kidney function tests show problems, but the damage started with your very first cigarette. The best part is that your kidneys start healing within just 24 hours of your last cigarette. The blood vessels begin to relax and open up again, bringing fresh oxygen back to damaged areas. Even if you've smoked for decades, quitting now can prevent further damage and give your remaining kidney function a chance to improve. Your smoking cessation strategy needs to be gradual if you've been smoking for years. Going cold turkey often leads to failure because your body is physically addicted to nicotine. Instead, reduce your daily cigarettes by 1 every 3 days. If you smoke 20 cigarettes today, smoke 19 for 3 days, then 18 for 3 days, and keep reducing slowly. Your gradual reduction plan works because it gives your body time to adjust to lower nicotine levels without shocking your system. Replace each eliminated cigarette with a healthy activity. Take a short walk, drink a glass of water, or do those chair exercises we talked about earlier. The improved kidney oxygenation you'll gain makes this effort worthwhile for your long-term health. Habit number 10. Regular screening. Problem: you can't feel kidney damage happening. Here's why this matters about regular screening. Kidney disease is completely silent until it's almost too late to do anything about it. Unlike a broken bone that hurts immediately, or a cut that bleeds and warns you there's damage, your kidneys can lose up to 90% of their function before you feel even the slightest symptom. By the time you notice swelling in your legs or feel constantly tired, your kidneys are already in crisis mode. The real problem is that most seniors only get kidney tests when they're already sick with something else. You go to the doctor for a cold, and they happen to run blood work that shows kidney problems. That's like waiting for your car to break down on the highway before checking if it needs an oil change. You want to know something that could save your life? Simple kidney tests can catch problems 5 to 10 years before you'd ever feel sick. Early detection gives you time to slow down, or even stop kidney damage using the habits we've already discussed. Wait too long and those same habits become much less effective. Your proactive testing schedule starts with understanding what tests actually measure your kidney health. The most important test is called eGFR. That stands for Estimated Glomerular Filtration Rate. Don't worry about the fancy name, just remember that a normal eGFR is above 60. Below 60 means your kidneys are struggling, and below 30 means you're heading toward kidney failure. Your home test calendar should include a kidney function test every 6 months if you're over 60. Mark these dates on your calendar, just like you would a dentist appointment. Call your doctor's office and specifically ask for a comprehensive metabolic panel that includes kidney function tests. The early detection advantage this gives you is enormous. Catching kidney problems at stage 2 instead of stage 4 could mean the difference between managing your condition with lifestyle changes versus needing dialysis. Make this testing schedule non-negotiable for your health. There you have it. 10 simple habits that can save your kidneys from failure. But here's what I need you to understand. Most seniors will watch this video, nod their heads, and then do absolutely nothing. Don't be that person. Your kidneys are counting on you to take action starting today. Remember what I said at the beginning. 90% of people with kidney disease don't even know they have it. Every day you wait is another day of silent damage happening inside your body. Pick just one habit from this list. Not all 10, that's overwhelming. Choose the one that feels easiest for you to start with. Maybe it's drinking water the right way, or maybe it's checking your blood pressure daily. Start there. Drop a comment right now and tell me which habit you're going to start with. When you write it down publicly, you're 3 times more likely to actually follow through. I read every single comment, and I'll cheer you on. If this video opened your eyes about kidney health, wait until you see what I'm sharing tomorrow. I'm revealing the 5 warning signs of kidney damage that doctors often miss, signs you can spot at home before your next doctor visit. Hit that subscribe button and ring the notification bell so you don't miss it. Your kidneys have been taking care of you your whole life. Now it's time to take care of them. Start today. Start small, but most importantly, just start. Disclaimer. The information provided on this channel is for general informational and educational purposes only, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider before starting any new diet, exercise, or wellness program, especially if you have underlying conditions or are taking medications.